Hello, my name is Favor Samudiame Ubede. Welcome to the Real Life Diary, where we talk about real situations happening in our current generation. And today we're going to be talking about the potential health issues in pregnancy. This is not fictional. Potential health issues, as in real life, what really happens during pregnancy. And we're gonna talk about it in three stages: the common health issues in pregnancy, the pre-existing health issues, and the severe health issues in pregnancy. Yes, you heard me right, severe health issues. In fact, there are some I think you probably have not heard of. Okay, first of all, I'm not a doctor, I'm not a midwife, but experience made me do some research about all of this, and I feel it's something the world should know about. For the common health issues in pregnancy, we know of the morning sickness, the back pain, headache, stomach pain, pelvic girdle pain, cystitis, um, varicose vein. We know of incontinence in pregnancy, peeing in pregnancy. I wrote some of them down because it's a lot. Pile, piles in pregnancy. Some people develop pile during pregnancy. Yes, we have bleeding gum, nose bleeding, swollen ankles and feet, stretch mark, tired and sleep problems. A lot of people they say they sleep very well during pregnancy, but there are still some who suffer insomnia. Sleeping becomes a problem. Their head gets hot, body gets hot, they cannot sleep, they cannot concentrate. Yes, that happens as well. Skin and hair changes. Feeling hot, feeling faint, cramp. You see some people they suddenly just change their colors just changes all because they are pregnant and you're wondering, oh, is this lady that I used to know? Yes, it's the same person that you knew. Okay, or the same person that you know. Sorry about that. uh we're talking about the. I'll talk about the morning sickness today. Morning sickness is actually talking about the nausea and the vomiting. It's when the pregnant woman feel sick or is actually sick or the both. Like they feel sick at the same time they're vomiting. Some they might just be vomiting, but they don't really feel sick that much. They don't really feel it. But some it just goes together. Yeah, and I don't know why they call it morning sickness, because it happens at any time, even at night. You can experience it all through the day. You can experience it sometime in the day. I don't know why it's come. Maybe because it happens during the first phase of the pregnancy. Usually it's from the 4th to 6 weeks. That's when it begins. Up till the 16th to 20th week. But for some people it goes beyond the 20th week. Okay. In this morning sickness that we call the common health, that is part of the common health issues, there's also an uncommon health issue in morning sickness. It's called the see, let me not cut my tongue. It's called the hyperemesis gravidarum. I'm not a doctor, remember, so in case I'm not pronouncing it right, but it's called the hyperemesis gravidarum. It is a situation where the woman experiences severe vomiting, severe nausea and vomiting. She cannot keep food down. She cannot keep fluid down. Yes, it's so severe that the person can even suffer from dehydration. Okay, it's so severe that the person vomits so badly as if the intestine is coming out. Okay, because I've seen this live. I've seen it happen to somebody live. Like she will vomit to the extent where she will just lie on the floor of the toilet. There's no strength. Once she puts fluid in her mouth, she has gone to throw up. There's always bucket by the side. It is terrible. It is not a good experience at all. That's not not the pregnancy, no, but that condition is not a good experience. So please, if you know anybody suffering from hyperemesis gravidarum, please tell them to talk to their doctor, their midwife, or just please talk to your practitioners. For hyperemesis gravidarum, let me tell you what happens. It's although it's not known what causes it, but some people, some specialists says it's hormonal changes in the female body during pregnancy. Some says that when it's said that if a mother has it, there's a tendency that the daughters will suffer from it. Or if you've had it in your first pregnancy, there's a tendency you have it in the second or the next pregnancy, but you have it again somewhere. So it is advisable that you speak to your doctor if you've ever experienced it to prepare for the next one. Yes. Okay, I know some people are asking, you might be thinking, what's it called? What are the treatments for, what are the signs and symptoms of hyperemesis gravidarum? One is severe and uncontrollable nausea and vomiting, low blood pressure, weight loss. And weight loss is really important to talk to your doctor, because the weight loss can also affect the child. It can lead to a low birth child, like the weight of the child will not be as expected. Okay, dehydration. With dehydration, you suffer thirst. You're not able to pee well, as in there's no fluid for your body now, so you pee less, dark and offensive urine, and every other thing that you suffer, people suffer during dehydration. Yes, please speak to your health practitioners. And for the treatment, they know better what to give to you, because first of all, they will need to examine the person to rule out, because there are other situations that causes severe nausea and vomiting. Don't get me wrong, there are other health conditions that can cause it, but they would have to rule out hyperemesis gravidarum first. And in some cases, these patients are being admitted, because when the vomiting becomes very severe, it will lead to admission. You need to be admitted. Sometimes they give anti-sickness medication, vitamin B6, vitamin B12, or steroids, or sometimes they combine it. Sometimes they have to admit the person so they can assess the pregnancy and know what's best for the mother and the child. They can give intravenous anti-sickness medication, or through the muzzle either. Or yes, there are several things that they can do, but please, you have to speak out if the vomiting and this nausea becomes severe. Usually, morning sickness fades on its own. Okay, it becomes better as you progress during the course of your pregnancy. But with hyperemesis gravidarum, the patient can suffer it until they deliver. It might not be severe at the end, but they might suffer it until they deliver. Some have to be on constant or usual frequent monitor. In some cases, some people have been admitted frequently. Yes, that's why I said there's a rare condition in that common health issue that will come on in sickness. Okay, thank you very much. In our next video, we're going to be talking about other conditions, other common conditions, before we move ahead to the other phases. So please, one thing I want you to understand is each pregnant woman, you can experience the same name of a health condition, maybe like back pain or morning sickness, but the experience is not the same. The name might be the same, but the experience is not the same. Don't be deceived. The way you experience it might not be the way the other woman is experiencing it. People experience health conditions in pregnancy differently. So please do not look down on anybody or try to, or say, I hear people say, some men say, and now today they get belly. Is it not just pregnancy? It is not just pregnancy. The experience in pregnancy is different. So please, support this. Pregnant women need support. They do need support, and especially those who are experiencing this kind of sicknesses, they need support from the hospital, from the partners, family, friends, neighbors. They do need support. Because that brings me to this again. Sometimes people that experiences people that experiences HG, let me call it HG, that's the abbreviation for it. People that experiences HG, they suffer from depression. Yes. Some suffer from isolation. They isolate themselves because they feel like other people do not understand what they're going through. So they isolate themselves. Some suffer from anxiety. They're anxious to go out because they feel if they go out, what if they need to vomit? Because this vomit is uncontrollable, it just comes. What if they need to vomit? What would they do? Where would they run to? So they just rather stay indoor. Some they wonder, why is it happening to me? Why should it be me? Why does it not happen to other people? How come it's just me that it's happening to? Please, if you're suffering from any of this, dehydration, if you're isolating yourself, if you're anxious, if you feel nobody understands you, please talk to your health practitioners so they can give you help. Um they can help you. Please do not die in silence. Please talk to your health practitioners. Tell them how you're feeling. Tell them what you're thinking about so they can help you. It's not your fault. It's the hormonal changes in the body. It is not your fault. If you see anybody suffering from severe vomiting, severe nausea, please pay attention to those people because it is not easy. It is not just normal vomiting sometimes. You will have to watch out. Thank you very much. If you enjoyed this video, please share so the world can see it. And we're going to be talking about more conditions and control measures as well. Like I said, for the anti-sickness drug, the B6 and the B12 and the steroid that these people are being treated with, it's not what you prescribe for yourself. It's what the doctor will have to help you with. Thank you very much. Bye. Okay.